Last week alone, 310 procedures were completed in Wellington Hospital's main radiology department and 765 procedures in its emergency department. With quicker access to more accurate scans, the team here will be able to see more patients each day, helping people to get a diagnosis and a decision on the right treatment faster. Part of the discussion we were just having was, I think it's a monthly scoliosis clinic, monthly scoliosis clinic. Scoliosis is quite a complex malformation generally of the spine, and what was explained to me was that normally the radiology could take an hour positioning people. With this new equipment, it's down to 30 minutes and less movement and less positioning of the patient. The machine does the movement rather than moving the patient. And that's quite significant, a 50% improvement in time just for that particular pathology. This clearly links to our government targets, our focus on building a health system that's more efficient and provides New Zealanders with timely access to quality health care. Investments in more efficient, up-to-date technology, like the machine we're looking at today, will help achieve our targets like reducing wait times for first specialist assessments and planned care. The faster access to more accurate x-rays also improves the flow of patients through the hospital, helping specialists make decisions about the right treatment faster. If you're coming through Wellington ED, for example, you'll spend less time receiving your scan. The ED clinician can see the x-ray almost instantly, make a faster decision about whether you should be treated in the ED, admitted or discharged. Another example is patients referred through outpatients clinic who will spend less time waiting to receive their results, starting that clock on their time to receive treatment. Every step along the way to treatment matters, and I recognise that timely access to diagnostic radiology services is essential to help New Zealanders get a diagnosis and receive the right treatment sooner. These new radiology machines are part of a broader program of work to level up access to radiology services. In some parts of the country, people are waiting a long time for radiology services. Earlier this year, I announced a $30 million initiative, which was a community initiative fundamentally backing general practice and permitting them to refer into radiology. Those referrals go into a hub if there is public system capacity in an appropriate time frame. That radiology is undertaken. That radiology is CT, diagnostic ultrasound and plain x-rays. If the capacity is full in public, then they are referred to private and the copay is paid by the system. That's being rolled out in this region, in Cape Coast and Hutt Valley first, and then deployed wider. In closing, then, I'd like to say thank you to all those involved in this project and the careful planning and coordination it's taking to get to this place that we are today. And I look forward to seeing even more of the machines, particularly the other 6 here in operation. It's been useful talking with the staff and their observation that, of course, this is the only one that's deployed at the moment. The rest will be deployed by the end of the year. This is the popular room. This is where staff want to come to, play with the new kit, if you like, and I understand that. But also what a morale boost it has been to staff to have new equipment and know that they're delivering a better, faster service for their patients. And a smile on the face of staff doing the work is a good thing and something we cleave towards as well. So it's a thank you to staff, it's a thank you to the operational team, to the management team for bringing this up, as I understand it, on time, on budget and in scope. And we look forward to the other 5 machines being deployed here and the second one deployed in Kinaparu. So thank you for what you've all done to get us to this stage today. Happy to take any questions.
So there only is over 7? What
8. 8, 2 at Kinaparu, 6 here. Yeah.
What's the cost of these machines?
I would have to check. I understand it's a 10 million, sub 10 million project, but I'd turn to the project.
180 per system? 180,000? And how will this affect wait times for MRI scans for people who are willing to be waiting 9 to 12 months for routine?
Sure, this is not an MRI, it's a plain X-ray.
Any radiology wait time?
They're not interchangeable, they're quite different modalities. So no, this does plain film X-ray, MRI is completely different.
If there are wait times for plain X-ray, then one would expect that with the efficiencies we'll gain here, those wait times would improve. That would be the expectation.
How much time are you hoping machines like this might save the team?
Well, the example I gave you with the scoliosis clinic was 50% gain in efficiency, again, not having to move the patient, the machine doing all the movement. For sharper x-rays, for less radiation, that's always a good thing. So, projected maybe 30 to 50% efficiency gains.
Right, and out at Kinaparu, that they've got some staffing issues out there. Are they going to have enough staff?
Yeah, raised that question here. Because these are replacements rather than add-ons, so we didn't even necessarily add new staff. There is the staff at the moment to run these machines, but it is a good question. We still need further MITs and MRTs to really get up to full establishment. But at the moment, because these are replacing machines that were nearly 20 years old, the existing staff will be able to operate them.
What will this mean for patients? How significant is the upgrade for patients coming
What this means for patients is that they're more likely to get their plain X-ray radiology done sooner, and when they're here, they'll have a better, more comfortable experience, less moving of them, the machine will move rather than them, and so their whole patient journey experience should be both faster but also more pleasant, and the results we get are better able to be seen by the specialist to make the diagnosis. So a number of benefits for patients, quicker access and more efficient when they are actually having their X-rays.
How much do you expect them to be able to upscale the capacity of X-rays?
So that's an unknown at the moment. What we're doing is replacing, so we're not adding on again, but with that 30 to 50% efficiency in what we're able to achieve, that would be a rough figure around what we'd hope that we could increase the input by.
So maybe up to 160,000 X-rays?
Oh, I'd have to do the maths on that. I haven't seen the modelling or the business case, but just the moment by moment individual benefit of 30 to 50% efficiency could be extrapolated out.
And did this money come from the existing budget that had already been committed by the previous?
Yes, that's correct. I understand the decision on this was made towards the end of last year. Yeah.
And so what are you doing to reduce this long MRI wait times, appreciating accessibility?
So it is a separate issue. MRI wait times are primarily a feature of health workforce, so we have the equipment here, particularly the medical radiation technologists who I've met with, and we've discussed their training program, how we can enhance their recruitment, all the things that are necessary to improve the MRI health workforce. It is a challenge. That's quite a specialist workforce with a specialist training program and pathway, but I've met with the college and we're looking at how we can improve that and have more people through the MRT training program.
With separate people that run these machines, radiologists?
Well, you're able to comment to that. It's a different set of skills to do CTs, MRIs and plain X-rays. Some of them cross across. Some can actually do that and do sonography as well. But the medical radiation team for MRI is a special set of skills.
Okay.
There's a split between public and private. Obviously, the public system can't do medical imaging, but in private. What's the plan sort of going forward in terms of the maybe expansion of the private sort of side of that? Is there any sort of move to maybe bolster that?
Yeah, so it's an interesting challenge. As I said, I mentioned the initiative I announced a few months ago that give people access to private. And what we're also observing is a move of the health workforce in radiology from public to private, which creates some of the challenges that we have. We have no particular plans towards utilising private beyond the initiatives that I've described with you. We want to build public sector capacity as our first instance, but also our reality is, as you can see from that initiative, that if public sector capacity cannot cope, then we will have collaborations with private.
And obviously the pay rates in a lot of areas for staff are better in private than public. Are there any moves to fix that?
Look, that's a discussion with the employment relations team. It's a challenge not just for radiology, but we have some of those. In fact, it's almost reverse sometimes. Some of the pay parity, if you like, discussions, for example, with community nursing and Health New Zealand nursing, it's a reverse situation. So it's nothing that we're focusing on at the moment, other than trying to build the health workforce.
Questions from a colleague on a different issue. If you have a minute.
Have you just? Yep, go ahead.
David Roxon Christchurch wants to know, to combat addiction to nitrous oxide, will the government look to restrict the sale of those chemicals?
So this is an interesting question in as much as that responsibility sits across several agencies. It can sit with food safety, a little bit sits with health. It's actually spread across several areas. And just recently I've commissioned a briefing on that to say what levers do I have in health that might be able to remedy that situation, because I don't think any of us are pleased with the use of nitrous oxide other than its intended purpose, which essentially is in baking, cooking, and to have it used elsewhere and to have clinical complications of that is not good. So who's got the levers? So just recently I've commissioned some work on that to say what do I have? My understanding at the moment is it mostly sits with food safety, but if there are some health levers that I can pull, then I'm interested in having that discussion with Cabinet.
So does it concern you that you can buy large nitrous oxide canisters from vape shops?
Yes, it does. And online.
And can the police or government do anything?
This is exactly the question. Who's got the levers? Which agency does this sit in? So I have purview in health, so I've looked at what levers I can pull, and then I'll work with other agencies to see who's got the best set of actions that we can take around that. So yes, I'm concerned around that.
What risk does NOS pose to people?
What risk does what, sorry?
With people who take names or whatever, what is the health risk of it?
Yeah, so obviously altered consciousness, which is part of why people are taking the nitrous oxide anyway, and then the implications that can come from that, obviously accidents and things that happen when you have altered consciousness. My understanding is there can be more longer-term neurological deficits as well, is my understanding with nitrous oxide. So it is something that does need some serious attention. Yeah.
I've got also a question from Chloe.
Yeah.
It's regarding the reports this week of patients driving from Kaitaia to Whangarei, Auckland to access a GP. Are there any moves to encourage GPs to rural areas?
Oh, a lot of moves, and that's actually been a situation for quite a period of time, unfortunately. I recall, I think it was Switzer Home in Kaitaia, an aged residential care facility that potentially needed to close a year or two ago for the same situation. Look, there are other parts, a number of parts of the country where books are closed as well, and people aren't able to get onto a general practice. And so this talks to the wider issue of building the primary care sector, how we do that, particularly out in the rural communities where it is hard to get general practitioners. So yes, I was aware of Kaitaia particularly. It is an area that has been under challenge for quite a while. I met with Te Huku Hauora in Kirikiri. They actually service all of Kaitaia. They're one of the biggest providers. I think they have about 12,000 people on their books week before last, and we were discussing their provision of primary care into places like Kaitaia. So yes, we're working hard to remedy that, but it is a longer term solution.
And is the government still committed to a rebuild of Whangarei Hospital, and if so, within what time frame?
Oh, it's still a high priority. If we look at the Tranche 1 priorities, Nelson Hospital and Whangarei are a high priority. Whangarei, the acute services block, is through design mode at the moment. Recently, as part of the Tranche 1, recently opened the Kotuku block, which is a maternity, inpatient, paediatric and laboratory on the top floor. Very shortly we'll open the whānau residential house, and then following that will be the outpatient child health centre. So it remains a high priority. Very good. Thank you very much. Again, thank you.